Georgia to get to me. I was their only child, so a child psychiatrist, and basically everybody in the state that failed, treatment in the other 4 psychiatrists I got. So I had really a lot of good experience with the worst of the worst patients. And then 9/11 happened, so I came home to New Jersey. I'm actually originally from New Jersey. All my family's up here, so I've been here ever since. Autism is a close to home for me, and before I even had a son who was on the spectrum, I just picked up on it very, very easily. Always was the first one to pick it up when we had a one of our mock boards, and it was an autistic child. I just seemed to have that affinity, so I did a lot of research, and that was in in the late 1990s. So since then, I have treated hundreds, probably, I don't know how many hundreds, but over 25 years of treating autistic children. And because I was the only specialty, in a 50-mile radius, or specialist who even knew anything about psychiatry, autism, I got pretty much all of them. So I've been working with from very mild, mostly more mild because I'm outpatient. So I usually see the more mild than the severe. So I have a lot of insight into working with them, and the more I worked with them, the more they taught me how they work, how the brain works. So some of this is my own understanding of autism. I don't have any studies to prove a lot of what I say, but my son is 17. He's on the spectrum. I was married for 20 years to an Asperger's. And I myself was severely autistic as a child. My mom, I was born in New Jersey, and there's a huge rate of autism in New Jersey. New Jersey and Alabama happen to be the 2 highest states with autism. My mom took me to West Virginia, and I lived basically off the land. No toxins, no preservatives, no, processed food, basically just natural, veggies. And by the time I was 12, my language was pretty much almost normal. Most people can't tell I have autism. I certainly don't look it. I still have some weird things, so I'm not, but I also, because of the way I am, I have a lot of insight and understanding to how the brain works. And this, autism is a neurologic disorder. This is not psychiatry. Psychiatry is based on symptoms, and it's more, brain chemicals is like the theory, but autism is a neurologic disorder. It is basically, similar to any other neurologic disorder, and it's genetic, very genetic. Is it simple genes? No, it's multiple genes. And they also have to have stressors involved. They still don't know exactly, I think, for each person, different stressor, whether that's, a stressor, the parents' divorce, a stressor from immunization. So yes, do the immunizations cause it? Not necessarily cause it, but there can be the stressor that triggers, the genes to come on. So it's very similar to if you see Down syndrome, if you see a person with Down syndrome, they have Down syndrome because of how they look. They have certain illnesses, certain problems. Well, autism is, these kids are the same. They are more like each other than they are their parents, unless their parent, of course, is on the spectrum. But, do they look different? they, you can't really look at them and know. So it's not a physical. Well, there definitely are a lot of FLKs, we used to call them, funny looking kids. There are quite a few of those that are on the spectrum, but for the most part, they look normal. But they all have very similar areas of problems. And the DSM, you probably all heard of the Diagnostic Statistical Manual. That is the, basically the Psych Bible. And that's what they, have done, used studies. In the beginning, it wasn't too good, but DSM-4 was when they finally really started using a large amount of studies to come up with, their symptom list. But it's based on symptoms, and the symptoms, it doesn't matter where the symptoms come from. So number one, we have autism, which is the worst of the worst. So like say the top 10%, the worst 10% is studied. And that's where they started to get, they all have certain problems, social problems, repetitive motor behavior, motor movements. So they all have certain symptoms. And then eventually they realized, gee, there's a milder version. So they started studying those. And so then we became, we went from having like severe autism to then having PDD, pervasive developmental disorder, the Asperger's, and then autism. They're actually Asperger's actually I never saw one Asperger's and hundreds of kids on the spectrum. Asperger's was, they had perfectly normal speech. And they had the other problems, the social, all these other issues like autism, but the speech was supposed to be normal, no problems. I didn't find one that met that criteria. They all had something, whether it was a delay, whether it was they couldn't do the back and forth social communication. They all had something. But anyway, what I found was there was, they studied that top, let's say 20% of kids who have this, but what about the other 80%? So the 0 to 80, think of it like, when you think about social communication, being social, there's an area where it's what we would consider normal or, typical. And then you have, think of it like you have the normal or what we call typical. And then as you move away from that towards non-social, completely non-social, you start here, you go to the end. So that's what they study, that little tiny 10% of the severe, behavior problems. And then they have that, like I said, that next step. But what about from there to normal? What about those people, those kids? And what about the opposite? For every yin, there's a yang. So what about the social butterflies? So here we have normal or typical socialization, and then you move away this way, going towards social butterflies. So now a child with no stranger anxiety talks to everybody. Is that normal? Typical? That is just as bad as being not social, only in a different direction. We need stranger anxiety so we don't get stolen. So again, we have this little part in the middle, but we have from that edge to basically, I call it the two extremes. So if you think about the similarities of the severe, they're all in these little sections. So like change, transition, that's a problem, very common problem that they don't, they have trouble with that. Well, so do the ones on the other side. What happens is the milder ones are what's missed. Their symptoms are mild, and they're also unique. I'll have brothers that one sibling, his mother cuts her hair, and the child totally freaks out because that's a change. But the other brother's fine with that and doesn't care. But mom washed the blinds. She washed the blinds, took down the drapes. So mom put up only one of them. The other brother is just hysterical. Behavior's, very bad. They couldn't figure out what it was until a couple of weeks later when she put the other back up. And then we're calm. So again, the problems with change, transition, and if it's more appropriate, then it's not a problem or not considered a problem. So if a child has an obsessive interest about, something that's more acceptable, then, let's say they're obsessed with, oh gosh, I've had so many kids with so many different types of obsession. But if it's, let's say, history, and they're very obsessed with something about history, then that obsession, really is not considered necessarily. It's just, oh, they're really, really interested in this. But you have a child who is obsessed with Pokemon, and he's 12 and he's still obsessed with Pokemon. Now it's obviously not normal, or not typical. So I think a lot of times the milder ones are overlooked, and people don't see that they're the same. They have the same problems. It causes problems in school, the socialization. These kids, they make friends very easily, but they don't recognize, the nonverbal social cues, social, being able to have a conversation. They may be so anxious and overthink every little thing that they do, that they can't socialize normally. So it's not that they don't want to socialize. That's an assumption, that they don't want to because they don't have friends, and some don't. They're all so unique. They're so unique. But the milder ones are the ones that are really missed. And because of the new DSM-5 is a nightmare. People who didn't belong in medicine making decisions in psychiatry started putting their nose in there, and they wanted less children to fall into the autism category. And really, autism should be called pervasive developmental disorder, or ASD is fine, autism spectrum disorder, because then it helps people understand, because a lot of people don't know what pervasive developmental disorder is. But pervasive means, ongoing development as the brain develops, and disorder is not normal. So I really think that should have been the name, so that people understood that, when you think autism, we just think of that serious, severely non-social, unable to function in their own world kind of kid. So, but the milder ones, like I said about the DSM-5, they made it so that not as many children fall into the autism category, so that, because it's an epidemic now, and they don't like that. The government especially doesn't like that. So we needed less people to fall into the category. So the children that are the mild ones have the same brain, but they're not going to get the same treatment or the same services. And I just testified in a trial in Colorado, actually, a child who was mild, never got treatment. Now his parents were they separated when he was little. Mom was very into nature and natural, and no immunizations. And I'm all for natural and nature, and I like to do the holistic thing. But you have to do something. Being natural doesn't mean doing nothing, which this family basically never helped him. His behavior problems started when he was very young. In school, they recommended like an IEP, like at the age of 4. When I saw him when he was 13, he still didn't have one because parents, didn't want that kind of help for him. So they let him suffer, so he needed help. They recommended therapy when he was like 4 or 5. Parents didn't get therapy until he was suicidal. So, so that boy, when he was 13, I saw him, diagnosed him on the spectrum, basically PDD back then, because he was so mild. He was very, very bright. He would not put, his symptoms were, and the such mild symptoms that everyone just totally missed it. He had, just some things at the top of my head that most people don't even know is something that they all seem to have, and not all of them, but a lot of them have this, this thing about being fair and right. They follow rules they're very concrete. So anything that's like a rule, it's a rule. And it's like they'll even get in trouble for sticking up for like another child, because the teacher, he or she feels the teacher's not being fair to that child. So he'll actually interfere and get in trouble because, he doesn't feel that, that's how strongly they feel. And the behavior problems, that's another thing. The behavior problems, all these kids have sensory integration dysfunction. All of them do. And that's not even in the DSM. That's not acknowledged. Most people don't even know what it is, let alone that it, exists. And all the kids on the spectrum have it. How I explain what sensory integration is, for those who don't know it, is basically the brain, basically when we're little, when we're the first 2 years of life, all we do is absorb stimulation. We're exposed to everything. It's, our brain is just absorbing and seeking everything. And we go through all these different phases, like we'll go through a biting phase. We put everything in our mouth phase. So we have to go through these phases, like developmental phases. And because their brain is, think of it like it's literally growing, and I'm sorry if I'm jumping around, it's growing from birth into adulthood still, even parts of it. And that's actually the bottom line for autism, if you want to get really nice and technical. It is a brain that grows uniquely. It is growing uniquely, thinking, working, interpreting, everything in the brain. Basically, there's all these different pieces, and some pieces like verbal, some kids are very verbal, but then their social's behind. And they might have, motor issues. Oftentimes it's like the fine motor we expect for a lot of boys, but when it's gross motor and not fine motor, then it's confusing. So we'll see, different areas of the brain, whether it be like with reading, maybe very advanced. But if you have a brain that's continually growing, it's continually needing a huge amount of stimulation. So it's kind of like the bottom part of the brain, the cerebellum and everything, the brain stem that runs the show, makes our heart beat or lungs work. That part is like still in control and seeking stimulation, because that's how the brain grows. Excuse me. In order to grow, it needs stimulation. So, after that first couple of years, the brain is like moves on to the next milestone of, okay, I don't need as much stimulation. I can start the cognitive area can start to take off, and the need for stimulation comes down. But in these children, that doesn't happen, because they still have areas that are like the social area still, it's almost like the brain knows it's not full grown. So it needs stimulation. In contrast to ADHD, excuse me, ADHD, a lot of people don't know this either. ADHD is a very genetic thing, and it's not actually diagnosed until autopsy, because they have found that it is their Schwann cells. They do not have enough Schwann cells. So you can't, it's basically like kind of like MS. You have to rule out everything else to know if it's truly ADHD, because you can't tell how many Schwann cells there are till autopsy. So those children's brain is also not full grown as far as, it knows it needs more cells. So it's constantly seeking stimulation to try to grow that area. And because the symptoms of that seeking stimulation, those are the ADHD symptoms, being hyperactive, is because their body literally is looking for stimulation. And if we aren't getting the stimulation, then it will seek it. So in the ADHD child just needs stimulation. It's not picky, doesn't care what kind, where it is. If you and I are speaking and that's enough stimulation to make our brain happy, we block out everything else. But if it's not, if our brain needs more stimulation than that, then it's almost like our brain is opening up to the stimulation around us. So it'll initially just, other things in the room, like maybe, an air conditioner, you'll become aware of that. And, a fan, if that's not enough to make the brain happy, then you'll start to be aware of what's outside the building, what's, the road, the cars, things like that. So it's almost like the more stimulation the brain needs, the farther and the more it looks farther outside us. And if that's not enough, then we start to wiggle a leg or tap, or, we can do, we basically, eventually we will get up and move, because our brain says, I'm not happy, I need stimulation. So the two have the symptoms exactly the same, but the autistic brain is picky about what types of stimulation. And it may take longer to get satisfied. I don't know if that's the right word, but the biting phase, first of all, may happen when they're 6. That's not what we consider typical. I'll have a kid who's 8 who starts putting everything in his mouth. And so it's like they never went through that milestone. And now the part of the brain that needs that is doing that. And they may take 6 months to get through the biting phase. So you'll see areas that are very specific, that are growing at a different rate. And because of that, that's what basically is responsible for the sensory integration, because it is, very picky. It's wanting specific stimulation. And for all the brains, it doesn't matter what kind, typical, neurotypical or not, the way it gets information is it's, cells have to send a signal to the brain. Even pain is not actually felt, in your hand, it's your brain, right? So everything is relayed to the brain. And the problem with autism is, I tell parents, it's kind of like there's a little interpreter up there, and everything that's relayed to the brain has to be interpreted. So their brain, their interpreter is French. It's just learning English. So they start interpreting things incorrectly. So what happens is you'll have children with a high tolerance for pain, right? Lots of people have heard of that one. And it'll not necessarily make sense, because a child will, be standing on a broken leg, and you're like, why, how, how can they do that? And that's because their brain is interpreting it differently. And then you'll have them, get a little tiny, bump, and they're crying, screaming bloody murder. But think about, it makes sense when you think about every single type of pain is different cells. If it's a stabbing pain or if it's a throbbing pain, they're different cells. So it makes sense that each one can be interpreted very differently. I had a child who told me pulling up his socks was physically painful. And so if you have a child who needs certain stimulation, their brain needs it. If they're in an environment where they can't get it, then they have to look for it. If their brain basically is also is unhappy, it basically, not only does it seek certain stimulation, if it's already, figured out a particular stimulation, it will not want that stimulation. So then you will have a child who is in an environment that's very stimulating. Let's say it's a lot of noise, a lot of lights. And then the child has a behavior problem because the stimulation, the brain is getting something it does not want. And it's very picky, wants what it wants and does not want what it doesn't want. So, and I'm sorry if I'm going around in circles. The interpreting stimulation and the need for the stimulation is so high. And a lot of people interpret behavior as behavior that because it's different in different environments, as it's controlled, but they don't realize the stimulation in different environments is different. And so their brain, it changes. Sorry. Their brain changes as it grows. So it's very inconsistent, or what it looks very inconsistent, because of the type of stimulation the brain is wanting or not wanting at that time. So that's very confusing for people, because they think, oh, well, if you can control it, looks like they control it here, they can't control it there. So then they get in their mind that it's something they can control. But it's really about the stimulation the brain wants or doesn't want at that time. And if you keep giving the brain a stimulation that it does not want, eventually it's like your last nerve. It's their nervous system is getting more and more tight, so to speak, and eventually you have the last straw. With the sensory integration, once you have, they can't modulate their nervous system like we can. So what happens is, when you or I get a stimulation that is our brain doesn't want or doesn't need, we just block it out. But they can't do that. They physically cannot do that. We have to help them do that. And because nobody knows what these the sensory integration, they don't even know it exists, they don't help them do that. So basically you eventually hit their last nerve and they blow up. They have an explosion. And basically it's like a nerve that you hit with, when you hit your knee with the hammer and you have a reaction, that nerve, it's a neurologic nerve, reaction. It's no different with this. And they have two choices. They have fight or flight, period. Those are your choices. So you have to prevent this. You can't, once it happens, once they explode, you have to run it. It has to run its course. So, and so people, they have a fight or flight. And some children always have fight. Some children always have flight. Teachers are a nightmare. They always interpret the behavior. They always have to confront the child now. The worst thing ever for a kid on the spectrum, because, first of all, the eye contact is very anxiety producing in children. So much better to sit next to them than to sit across from them. Even just looking at our face is very anxiety producing. So the teacher gets in their face and says, let's discuss this now. And the child, the teacher's gonna either get it in the face or the kid will run away and run out of the building or whatnot. So that's one of the biggest problems with the kids, that they have not been recognized as on the spectrum. And because of that inconsistency, again, it's all about stimulation. And what the brain needs. Sorry, I've gone, let's see. Oh, that case I was talking about, the one in Colorado, who the parents never got help. Probably, I don't know that they believed me. I think they did to some extent, because I ended up seeing them because the other doctor, who was an adult psychiatrist, interpreted his behavior as bipolar, which is often, they're often misdiagnosed as bipolar because of those explosions that they can have. You know, but it's not, it's like I said, it's coming from a totally different, a different area. And it's just like the ADHD symptoms, the bipolar symptoms, they can have bipolar symptoms, or at least what's interpreted as bipolar symptoms. So they're often misdiagnosed as that. The control issue is a big thing. Teachers get into power struggles. A lot of parents get into power struggles with their kids because these children argue with them. It doesn't matter if you're an adult, if their brain tells them that that's not right, then it's not right. And they don't care who told them it's not right. And what happens is, first of all, the parents think it's about power, but it's not about power. The kids don't care about power. Their brain just tells them it's this way. And it can be something so minor, like you're eating the chicken the wrong way. It can be something, it's can be so minuscule. And the kid will argue till the sun goes down. And the parents think that the child wants, like I said, it's a control thing, but literally the child may actually feel so uncomfortable, at the thought of that this isn't right. The way my brain is, it says it's this way. And if you say it's a different way, it literally is so uncomfortable for the child. It might even be painful, and they will freak out because they are having a physical reaction. It's not about being in charge or being, the power. It's about, I feel horrible and I need to change that. I need you to say it's this way in order for me to feel better. So I see lots of people getting into power struggles with these kids just because the children can't verbalize what's going on. We relay, we teach our children what's hot, what's cold. We label everything for them. And what if a child, their brain is interpreting cold as hot and vice versa? What happens is, how confusing is it to a child if, they get close to something that's hot, you smack their hand and say, stay away from that, that's hot. But that felt nice to them. Hang on one second. Yes, Gavin? Okay, I'll be there shortly. Okay, honey? All right, I have to cover my son. I have to tuck him in. Give me 5 minutes. I'll be right back.
Anybody have any comments or questions while we wait? We had I did a two-part lecture on autism and hormones, and a lot about what she's talking about was actually sort of shared in that. One of the highlights that we found was that early on in utero, a lot of these kids, it's found retrospectively, have both high testosterone levels, higher than they should, and also high growth hormone levels. And it affects something, what we call executive function. So executive function deals with memory, concentration, being able to start projects, being able to finish projects, multitasking easily or not. And we found that these kids early on, their heads grow at a accelerated rate versus their brains, and they sort of have almost like empty-headed as do their bodies. And usually by the time that they're 5 years old, that their head circumference is that of a teenager, which is about, the maximum. So that's that was one area, but there's a disconnect. Those of you know who about the growth hormone has to be conjugated in the liver to IGF-1 for it to do its thing, to the useful part of growth hormone. And there's a disconnect because we were reading about a hospital in New York giving kids IGF-1 that are autistic and seemingly getting much better behavioral responses. I'm just throwing my 2 cents in here, Dr. Stone. We did a study a couple of years ago on autism and hormone abnormalities, and I was just kind of sort of relating to what you were talking about as far as behaviors and whatnot with hormones. And so the short version is that there's a disconnect between IGF-1, that usually seems to be, or rather growth hormone in these autistic kids, and IGF-1, which is the usable portion. It doesn't convert, and it needs to for the growth hormone to be effective. There's also seems to be a high incidence of elevated testosterone. When you trace it back, you can find it in utero. The testosterone levels in these kids who become autistic are higher than they should be by not a fairly measurable amount. And I don't know if you have any experience with that. It's fairly consistent. But I'll let you continue. Go ahead.
All right.
Those are my 2 cents.
All right. Just a little aside. As you saw or heard, my son needed to be tucked in. We have a routine and it has to be that way. So I knew better than to argue or say, wait, because he's not going to let up, because he has to have that routine. And if I don't do that, it's very anxiety producing for him and it gets worse and worse. So that's why the children will, they come to the parent, like when they want something, they drive the parent insane asking for it, because they're obsessing. Once it's on their mind, it just keeps going and going. It literally is, it's like almost like an OCD thing where they have to, it's uncomfortable. So it's very similar to that. So that was something that's a different kind of like almost everything has to be, the routines is very important. And again, it's based on anxiety and the feeling and how they feel. Definitely, there are other, illnesses or issues with the autistic kids, like what Dr. Clearfield was saying. They also are all their livers. There's studies showing that all their livers, at least everyone that they studied, they produce less glutathione. So they have trouble with toxins building up. Another thing they all have is enzyme deficiencies. They're born with enzyme deficiencies. And there's a doctor, I don't know if he's still practicing or still around, but in the Midwest, who took 50 autistic children and had them in a very controlled environment and were able to study them. And at that time, there was 5 deficiencies that they could be born with as far as enzyme deficiencies to break down certain foods. A lot of people have heard about the gluten, milk, the casein. So those are 2 very common ones. And there were 3 others. I can't remember, they're less common. And of course, you can have one or the other. You can have just one or a couple. I actually worked with a doctor here in New Jersey who was doing a study on kids people, not just kids on the spectrum, studying the enzyme deficiencies, like gluten, in I guess I was going to say old days, but not that far back. They only knew that there was, basically one gluten the test was less, I guess, specific. And now they learned that there's like 10 subsets of the gluten. And what was interesting about the study was every child who had the casein, or every person that had the casein deficiency had a gluten one too, not necessarily vice versa. So that was very interesting that they all had that. And I myself actually, being in West Virginia without the processed foods and whatnot, I didn't know there was an issue with gluten. I had the casein problem, and it always looks like they outgrow it. I love that one. They outgrow the this, but what people don't understand is it's an actual deficiency of that enzyme, and every protein, everything in the body has to be broken down and basically told where to go. Even if that's to leave the body, it has to be recognized. And what happens is when you have that enzyme deficiency, it doesn't know how to break it down. So it breaks down whatever the casein or the gluten, whatever protein it is, improperly in the basically garbage chains of protein. So what happens in that doctor in the Midwest, what he was able to discover was that those garbage chains of protein had to go somewhere. And he found 32 different areas in the brain where those protein, basically garbage, went. And very interestingly, those are autistic symptoms. They're some of their symptoms, the sensory symptoms, a lot of different symptoms. So they actually looked more and more autistic depending on how much of that, the gluten or the casein that they got, because they stuffed more and more of the protein into areas of the brain. And what I have seen is, I think every person that our brain sort of picks a spot. And what happens is, because it goes to the brain, it actually gives a euphoric feeling to the child or to the person. So they actually crave the very thing that's making them sick and making them look more and more autistic. So what I have found when I have take the culprit, basically the gluten or the casein, when we take it out of the diet, and then it's exposed, what do you call it? Think of it like, how the cilia in the intestines is, nice and lively when we're born. And the milk allergy or the milk reactions are huge, diarrhea, bloody diarrhea, vomiting or whatnot. But over time, as the body, after I've had so many pediatricians, they keep trying and forcing the parent to, okay, it's been 6 months, let's try it. Let's try some milk. If they keep pushing it and pushing it, I don't understand why it's such a, it's like, there's so many other ways you can get, calcium and everything, but they have to have milk. So, okay, give it a rest for 6 months and then we introduce it again. So they keep trying to do that. And because if you've ever been, started looking at, what do you call it? The, like packages, there's casein in so much stuff that, it's not necessarily milk, but they're getting bombarded with casein. So what happens is those little cilias get smooshed down, basically, so that now the surface area is so much less that their reaction that they have for getting, the milk becomes less severe. So of course that looks like they're outgrowing it. And so then they can now eat milk, okay, or drink milk or whatever, the cheese and whatnot, which of course makes them have more and more autistic symptoms. And what I find when I have them take it out of the diet and let those little cilias get healthy again, then they have, a big reaction. You can see it now. But what I find is parents will tell me what symptom they have based on where it goes to the brain. So I will have a parent, my cousin's child is on the spectrum. And before I really knew about what, knew about the casein and the gluten and the enzyme deficiency, before I knew about that, I spent, a beautiful day going out with the family. And I had, this little, he was probably 3 maybe at the time. And a beautiful child, we had a great day. Behavior was awesome. We come home and have pizza. 2 bites of pizza, which of course gluten and casein. And he had the milk issue, so that means he probably had the gluten issue. And 20 minutes later, it was like a switch. He became aggressive, bouncing off the walls, hyper, for 6 hours. And I was like, what did you do? What did you do to this child? And then 6 hours, it was like a light switch and he was back to normal. So I'll have parents that say, my child, I can always tell when he gets whatever it is, because his speech is slurred. It's like depending on where in the brain it goes to. My son, he can't have gluten. I can always tell when he gets it at school. He goes into, his imaginary, what do you call it? He starts to do gibberish. So he stops, communicating in English and goes into his fantasy world. So I can always tell it's much more, a lot more stimulating kinds of symptoms. What do you call it? Just a lot more physically, in his head and doing all kinds of things, having battles and things in his mind, and not really talking English. And that will last for so long and then it will go away. So it's almost like the body picks areas of where it deposits that stuff. And that doctor out west, Dr. Shaw, his name was Dr. Shaw, because it was a controlled environment, he was able to figure out what each child's enzyme deficiencies were and take those out of the diet. And because it was so controlled, it was 100%. Whereas to be out in the real world and have 100% take it out of the diet, you basically have to go live off the land because, everything's got so much crap in it these days. But what he was able to do after 26 weeks, it was almost like the body, like a computer, sort of went through and, checked over the brain and said, wait a minute, what is this crap up here? So it like purged it. And so after the 26 weeks, all of a sudden they didn't have autistic symptoms. So it looked like he cured autism. So, because again, it was like it purged all that crap out of the brain. But like I said, to do that in the real world, not in an environment that's controlled, is almost impossible. I myself mentioned that, I had an allergy, a reaction to milk when I did go down to West Virginia because we got cow's milk. So that caused what they thought was almost an anaphylactic like reaction. So I knew couldn't have milk of any kind. Of course, it looked like I outgrew it. And when I went to college, now I started eating all kinds of crap, milk, all the boxed, ramen noodles or ramen noodles, whatever those are called, all kinds of bad things. And within 6 months, I'm in the ER. I'm, getting all kinds of lovely upper GI, all this, having all these medical problems. And I just got sicker and sicker and sicker till I started having all these autoimmune problems. Again, I didn't know about the whole gluten. I just knew I had a casein issue. And of course I outgrew it. So, I was making myself sicker and sicker until I had found out that there was, 10 subsets and had some testing. So anyway, what time is it? I'm rattling on. Why don't we do some questions? Because I know I'm going around in circles a little bit.
I'd like to add something here, if you don't mind, Dr. William. regarding autism. I know it is abnormal in the neuroplasticity of the brain. Those kids, they born with abnormal connections and plasticity. So what's that mean? Well, it means that they cannot form new circuits of neurons with interest. In order to form a new circuits of activities that represent certain activities, they have to be connected to dopamine and all this happy molecules, so they have interest. And those kids, because of the inflammation and the inflammation and the neurogliosis, they cannot break up from the routine because it's those circuits that they're already formed are very tight and connected, and they cannot break up to form new circuits with interest. So they stick into their routines that they are doing because that's the only pleasurable things that they can do, and they cannot create a new circuits for activities and connect them with the happy molecules because they have abnormal plasticity of the neurons. Normally, you know, we can enjoy other things besides the routine that we're doing, and we can connect it with happy molecules, and we enjoy activities or social interactions, and all of this, it kicks up the dopamine and form new circuits and can be creative there. But those people, those patients, or those kids, they are stuck into their circuits because they don't able to form new circuits with happy molecules that will reboard that circuits and make those kids to moving out from their comfort zone. And so it's and what drives the whole abnormal neuroplasticity is inflammation. And I think there is some genetic factor there. That's why you have people have it and people they don't. But then there's also contribution factor, which aggravate the condition. So all what you're talking about, screening all these free radical generators and trying to neutralize them, it's possible as trying to reduce those insulting free radicals that may aggravate the condition itself. And so when you are saying that they have enzyme deficiency, they don't produce enough of glutathiones, they don't have enough of antioxidant expressions, they don't recycle toxins. Those are all aggravating factors, but there must be a genetic problem in the base, and all this are contributing factors. And yes, when you take care of all this contributing factors, definitely you decrease the inflammation of the brain, and the patient's neuroplasticity may gain back to not completely normal, but near to normal, something like that. And they start resuming other activities and forming new circuits. But once you quit eliminating those contributing factors, which cost too much of money because you have to supply them with all this supplements and all that stuff, and they have to maintain on it, just going against the flow. And definitely it requires a lot of care there. And also you need to do all this social interactions and care. There's a lot of behavior, cognitive therapies that goes along with therapies. Along with that, I mean, oxytocin, there's a lot of articles that oxytocin may help to increase the expression of antioxidants. So intranasal oxytocin, possibly methylene blue, those peptides that helps to decrease the inflammation, especially the Th17 inflammation, because that's the one that's causing the problem is Th17, and anything that helps to decrease specific Th17. So you need to go with maybe low dose naltrexone and all this good stuff that we are learning from here. Possibly this may help to increase the expression of antioxidant and possibly polarize the immune system away from balance the immune system, and polarizing away from Th17 overactivities. But it requires metabolic, it requires redox therapies, behavior therapies, and all this in order to reach to the goal of treatment. But again, as you said, if you stop take the control environment, they will relapse because there is a genetic background there. Possibly this genetic background can be kind of reversed by oxytocin, because oxytocin does work in increasing the expression of the genes and things like, I don't, we need to have some studies there, and their effect is a little bit long lasting. Some and peptides possibly with some genetic changes as well with those peptides that we're using. An example is KVP, had melanocyte stimulating hormone derivatives, and many other things. But giving IV glutathione is not a good idea, giving it all the time, because you have the glutamate part, which is neurotoxic, unless you're going to give NAC and acetylcysteine. I prefer giving NAC over glutathione. If you want to give glutathione just once a month, that would be enough. So those are the discussion about the treatments and pathophysiology, and I'm just trying to add this to the group here so we can have different insights and different inputs.
So,
Definitely. Yes, definitely. Yeah, sorry. There's, go ahead. Sorry.
would you want to answer the question? So what I put up here is sort of like a summary of, so what we found. So first of all, we found over 400 different genes have some effect, or some effect with in the autism spectrum. So it's a little impractical to go after each one of them. At least until we find one or two or five or six that are the main ones. But like when you were on your break, I was talking about we had done a study on hormonal abnormalities in these autistic kids, and one of the first things that apparently happens is you get a disconnect. You get a high growth hormone, an elevated growth hormone level versus a low IGF-1, which is the usable portion level, and it actually starts within 1 to 3 months of birth. And so these kids have big heads, bigger than most kids. All kids have big heads, but these babies have really big heads that the parents don't realize until maybe at a year old. But they're kind of empty-headed. So the body doesn't, the internal organs don't grow, but the skull grows, and sort of the body itself proportionately grows. So it seemed to be a disconnect, because like I said, the Montefiore Hospital in New York City treats these kids with IGF-1, and they seem to have some good effects, with hyperactivity and the flapping, the stereotypy, and depression, anxiety, and behavioral issues. So what I have up here are medications, as you can see on the top, that will help the growth hormone IGF-1 pathway heal itself. We find that the interleukin-6, the cytokine, is high in these autistic kids, extremely high, and it turns out that high levels of growth hormone increase interleukin-6, so it's sort of a double whammy. So some of these medications, so intranasal insulin is one that seems to be helped. Low dose naltrexone, as was mentioned. The TCDs, and these are again in low doses, will block interleukin-6. Statins and verapamil, and I've actually used this in low dose, like 40 milligrams, in kids with the stereotypy here, depression, hyperactivity, mood changes. Verapamil 40 milligrams, which is half a dose of. Usually it's 80 TID for high blood pressure. And I can never pronounce these. I know Dr. Spear's on now. I can never pronounce these biologics, but this is an interleukin-6 blocker. These are the supplements that will do the same thing. And there's a brand called Neuroprotect, NEURPROTEK. That's a combination of quercetin, luteolin, and rutin. It's about $39 a month. And so we've used this for the autistic kids also. Is a lot of what you're talking about dovetails with what we found with autistic kids, and symptoms are similar to a mild to moderate traumatic brain injury. Growth hormone excess is here. Memory issues, concentration, mental clarity, obsessive compulsive paranoia, poor concentration, inability to switch between tasks. That seems to be a big one, and that happens a lot with growth hormone excess. It's what's what we call executive function. And and this is a sort of a little schematic that I made of sort of the whole picture of growth hormone. So repetitive behavior, social isolation, hypersensitivity, maternal activation, which is sometimes infections, something happens in the utero. Infection, could be infections. Seems to be, like I said earlier, high levels of growth hormone and testosterone in utero causes microglial activation, inflammation, and cytokine storm. And we end up with the big-headed kid, elevated growth hormone, elevated interleukin-6, decreased IGF-1, increased IGF-BP1, which is the one of the transport proteins, cerebral damage, low GABA, which is the the calming neurotransmitter, and that's where we get the repetitive behaviors and restlessness. So that's a way to look at it, to sort of explain it. It's not the only way, but it's a way. And then we also found that there's high levels of testosterone in these kids. I have a good friend who's got an autistic son. I guess he's 14 now. When he was 10, I met them when he was 10, and we went to we were out somewhere, and it was in the summertime, and I noticed that he had a lot of hair on his legs. And so I asked Mom, I says, does he? And she says, oh yeah, he's always playing with himself too. And we did a testosterone level, and the kid's total testosterone was 674. It was like, he's 10 years old. So we did we gave him some, we just did some herbal remedies. We didn't do anything drastic to lower the testosterone levels. And he did quite a bit better until the divorced dad got himself involved and actually had me court ordered to not have anything to do with him. So, but that's another story. Okay. You want to answer some of the questions now?
Can you go back to the therapy so I can make a copy of it, please?
Sure.
I like the therapy plan.
There you go.
There's one.
Okay.
And
There's a second part. This is just one part. There's a second part to this where I actually go through each hormone, all 12 of them that we deal with, and look at them whether they're elevated or diminished. So we can do that some night if you like.
Yeah, please. I think this
I don't know if anybody else is interested in that. So
yeah, this is great. I like the way
I'm the hormone nerd. Everything
and we can make out of this supplement a gummy. That's what I'm doing right now. I'm working with supplement manufacturer, so I'm going to use this to make a gummy out of this.
All right. Well,
I'm going to steal this.
We're going to call it Dr. C.
I'll give you the loyalty.
Okay.
I'll give you the loyalty. I'll share with you the loyalty. Don't worry.
Please. Okay. So I'll answer some questions here. So Dr. Nario asks, is putting them on supplements a sign of help in the court?
It does sometimes. I certainly have, when you have a parent who's not doing treatment versus a parent who is trying to do, lots of good hormones, or not hormones, but like supplements and whatnot. Interesting. I'm looking at, I see everything from the psychiatry, standpoint. And when I first started, with treatment, that's not, trying to do things besides regular medicine and all of that stuff, trying to do, going down a different path. I always, start a supplement, of course, one at a time. And it was really interesting to see what symptoms, what autistic symptoms would like with the omega-3s, for depending on their age. In about 6 months, we would see, improvement in their speech, their language, with probiotics. It happened to, I don't know why 6 months seems to be a thing, but I also, would see within 6 months start to see, improvements in some of the social areas. The serotonin was a big one with my son. Nobody would have started treatment with my son as early, of course, as I did, but I was on Effexor, the antidepressant Effexor, and think it was Celexa, so high serotonin, and then effects with serotonin and norepinephrine. And when I breastfed my son for 2 years, I call him my effexor baby, the happiest little thing ever. When I weaned him, he actually, what I thought when we were so confused because, this child that was running around and playing all of a sudden couldn't walk down an incline, would actually put his hands down just to walk down an incline. And, at first we thought it was maybe a balance issue. We weren't sure what it was. And here it was anxiety. And when I put him back on a serotonin agent, then that went away. He became, it's like that anxiety was much improved. And the farther he got from my breast milk, the more autistic he became too, which was very interesting. So when I put him on serotonin, the socialness, it seemed like the serotonin was very responsible for socialness. But definitely someone had asked about some of the other supplements. I know you have a bunch of good ones. I used the
But I don't see oxytocin there in your list. Why is that?
This is just for the high interleukin-6 high growth hormone. This is not a complete list. Okay, that's what this is for. I have that's in part 2.
There's also low dose dextromethorphan and low dose Risperdal. Low dose Risperdal was interesting. Low dose Risperdal, a lot of people don't know about. And I wonder how much, learning about the hormones, how much of the low dose Risperdal had to do with the prolactin. When Risperdal came out in 1994, a lot of the really severe autistic children were taking like 5 medicines. They were on some type of a serotonin med, usually some type of, dopamine for the self-abusive. So even like a Haldol sometimes. So they were on like 5 medicines. So when Risperdal came out, it affected serotonin, dopamine, and alphas, which there now is Intuniv and Catfe. They used to be clonidine and guanfacine. They made ones that are, longer acting. So the Risperdal did it all together, in one pill. So they got changed over, and the children, they were on little dosages. And after what I found, about 1 month per age for year. So if they were 6, it would be about 6 months. They started developing social skills, eye contact. So it seemed like the Risperdal, the low dose Risperdal, really helped some of the core symptoms, which was very interesting. We didn't expect that.
Resveratrol is calcium channel blocker, and we know that NMDA receptors are open up for those people, and that causes neurogliosis. So you're blocking the calcium channels, you're blocking the glutamate with resveratrol.
Right. And like I said, it also, increases the prolactin. So going back to the hormones, I wonder how much it just seems to have a lot of does the right things. Like
what dose of Risperdal are you talking about?
0.5 is usually for most children. If you get to 1 milligram or above, it agitates them and it doesn't work this way. It doesn't seem to work. I think it affects everything a little bit different when it gets to the higher dosages.
You're talking about 0.5 milligram of resveratrol?
0.5, yeah.
That's very low.
I know, it's low.
I mean,
dose.
normally we get 500 milligram.
No.
No, Risperdal's 0.5 or 1 milligram. It goes 1, 2, 3, and 4, a 0.25 and a 0.5. I had children.
Yeah, there was a big problem with gynecomastia with it.
Right, and that's because yes, there was 50 of us from the United States that were chosen to teach other docs about this low dose way to use it. But this, lawyers got involved, red tape. They were afraid that if they said it helped autism and it more than just agitation for agitation, if we said, you know, it started to help some of the core symptoms like the eye contact, that they would get sued because that they, you know, didn't cure it. So they wouldn't let us teach the other, you know, the pediatricians and everybody. We weren't allowed to do that. So everybody used it wrong and they caused, you know, too high dosages. The gynecomastia was a mess. So they got sued all, you know, up the wazoo because of that. But the low dose, I would have children that were being, you know, very agitated by a higher dose. I would bring it down to 0.5. And then we would see the improvements happening. I even had adults who were had never been on medication, like in Alabama. Oh my God, there's no treatment at all for even medicine, let alone psych down there. And I would have adults that were on the spectrum that the low dose Risperdal would also help. So, you know, like I said, there's a lot of different, I think, aspects to that. But it has to be a low dose.
I think I'm confusing with resveratrol, and that's another supplement.
No, it's the
Think I'm-
same thing. Risperdal,
Is it the same you're talking about, resveratrol?
Risperidone and Risperdal. Yeah.
No,
I-
resveratrol is a supplement.
no,
that blocks the
resveratrol, no, you're not talking about that. She's talking about
Okay.
Risperdal. Resveratrol
Okay,
is,
so-
yeah, right.
So that's the reason I got come. So resveratrol, which is also helps autism because it's calcium channel blocker and blocks the glutamate. But now you're talking about another drug, which completely different. Okay, got you. Thank you.
Doctor, what age group did you use this low dose?
Like I said, even adults, if that were, you know, drug naive, I would even see in adults. So I know with my son, I started him on like Celexa when he was, so maybe 3, when he was 3. And then Risperdal, I added a little bit after that at the low dose. So I had some twins. I had 22-month-old twins and they were running into the wall and hurting themselves. And I did them with the Risperdal, the tiny dosage. I find almost everybody needs a 0.5. Every now and then I'll have someone who's very sensitive and only needs a 0.25. If you go up to the 0.5 and in the morning, they kind of look a little, you know, drugged, then I would know that, you know, to go back to the 0.25. And if you use 0.25, let's say you're just conservative, instead of, you know, it'll just take you longer to get where you want to go. So like I said, it was about 1 month per year. So at 6 months, we would see the improvement. If they were over 12, it would take usually between 9 months and a year. Even the child themselves would start to notice, wow, I'm starting to get friends. You know, they noticed the social things. The social things always were last, of course. And after about 4 to 6 weeks, the parents would start to notice, you know, the ones who didn't eat much or were very restricted, they would start to, you know, restricted in what they would eat. They would start to, you know, eat a little bit better. And it was interesting with the low dose, I did not have the problem with the weight gain. I only had the problem with weight gain in a couple who were very obsessive about eating something that was, you know, not good. But most of them, if they were a little bit on the overeating or obsessive eaters, it would actually come down more towards normal. And my ones who did not eat, basically, you know, didn't eat anything, they would come up and seem to eat more typical. I just saw a question come up about dextromethorphan. Yes, low dose dextromethorphan is another thing that's very helpful with behavior. We see a lot of, you know, it's not right for everyone, but for my people, you know, they did a lot of studies. I saw the studies with like the year, like 10 years old. I know I learned about it later. My son was older, so I started him on it when he was, I don't remember exactly when, maybe 12. And when he doesn't get it, his self-stimulating, he has a lot of, you know, almost like flapping, but his is more like he smacks his face or ears. And that will really decreases and actually greatly decreases. And if I don't give him the dextromethorphan, let's say we run out or something, that behavior increases, but it has to be low dose. Again, I think the cough medicine is like 10 mLs. Let's see, 5 mLs is like 30 milligrams, I believe. And that's the recommended dose, is the 30. So it's much less than than for the cough. Nuedexta is is basically dextromethorphan with quinidine, which they use for the brain injuries. So, we can't find that, of course, for kids. Can't get it approved, and I have not certainly tried that one. I actually take that because I have a traumatic brain injury. So, that's, there's a lot of studies with that in kids that, again, going back to their own, the traumatic brain injury, they basically have a lot of the similar as Dr. Clearfield was mentioning, a lot of similarities there. So I think that helps in that regard.
When would you use Celexa and at what dose?
I'm sorry.
When would you use Celexa and at what dose?
I'm sorry.
Alexa, when would you use
Oh.
Alexa and at what dose?
Yeah, when I have a lot of anxiety, usually like a 10 milligrams. And I think it's different for every child, but usually I usually use like a 10 milligrams. If they have, sometimes it can be helpful for the OCD symptoms too. Risperdal really helps with the OCD symptoms too, the low dose. So that usually needs a little bit higher, but usually it's 10 for most people, most of my kids.
Okay. We found that clonazepam at a very low dose, 0.3 milligrams, it has a GABA allosteric modifier, and it improves I have it here: cognition, social memory, anxiety, intellectual defect. 0.03 milligrams. Sorry, it's been a while since I looked at this. 0.03 milligrams a day, which has to be compounded, again, can be drowsiness, dizziness, those kinds of things. So what I had over here are some repurposed drugs. So butetamide, which is is a diuretic. Clonazepam, verapamil, these are all low doses, low dose naltrexone, statins. And so I put it together in this kind of chart here. So there's lots of things that can be done if we get away from, well, there's Risperdal and that's it, which is again, that's what the pediatricians, and at least around here where I am, that's all they'll do. Can we there's a bunch of questions in the chat. If I read it to you.
Sure.
This one we already know the answer. Can mild autism be functional in a sense that it can finish high school and college? So that's a yes, right?
Yes, definitely. Basically, the mild ones, can be anything, as far as, goes to college and med school, as I did. Yeah, that's definitely most people don't even know, that they have autism when they're really mild.
Is there a typical, well, there's way more awareness of it now than there used to be. Is there a typical sort of pattern of what happens to these kids once they become adults?
It really depends on how how severe they have it, because some are have to be more helped more, like a group home or assisted living kind of situation. And the schools out here are horrible. I fight with my school all the time. They're training my son to be a low functioning adult instead of teaching, basically finding his skills, because that's another big thing. You can have they have the splinter skills, so you can have a really bright in certain areas, and then of course can't function in the typical, you have to tell them to bathe and stuff like that. So it's just so unique, really.
There's a mention of a Dr. Rashad Buttar, who's an Army officer, who's apparently treated a lot of autistic patients. I don't know, is that apparently they're looking at detoxifying from heavy metals. I don't know if you have any experience with that.
Oh, definitely. And that, the NAC and the glutathione trying to help. I know with the little ones, Epsom salts, if you can get them to do Epsom salts bath can also help with the detox. So that's, yeah, definitely.
Yeah, well,
helpful.
so what happens with in the glutathione pathway and also N-acetylcysteine is that the mineral molybdenum gets chewed up, and it after, if you use it for about a year, it'll become ineffective. And Epsom salt baths are actually a good way to replace the molybdenum without having to give another supplement. So,
Right.
high testosterone and growth hormone in mom or baby? The answer is both. What to do with teenagers and college-aged ASD? It says DRT to the power struggles and limited thinking about fairness. I'm not sure what the question is there. It's from AS. If you're still on, if you could elaborate maybe, or maybe understand. I'm not sure what the question is. ASD or WRT to the power struggles and limited thinking about fairness. So
I do definitely see that. I see those sorts of symptoms decrease as they age. Again, that area of the brain, whether it matures, what I'm not exactly sure what, but we definitely see some symptoms that are problematic when they're younger that completely disappear, and then you can have new ones that show up. But that is one. With treatment, though, this child that I saw when he was 13, 15 years later, he shot 4 people and killed a kid. And that's why I was out, had to testify. He had no treatment, so that that fairness and he had a huge problem with, authority. And so no treatment is definitely, that's another thing with, how, I don't know, every 50 years, they kind of switch their, basically say, okay, the brain is maturing is going along next to, like growing along next to, neuro, what is it? Neurotypical. And then they change their mind and say it's growing away from or deteriorating. I think it's the deteriorating if you get no treatment, instead of the just growing alongside or differently. I saw 2 cases in Alabama, same psychiatrist or psychologist, 3 years apart from the testing. So very, very similar, basically exactly the same types of the same test by the same person. The one was a genius, the other one was average. And 3 years later, with no treatment, they both lost 30 IQ points. So, I think that doing the supplements and treatment is just so important, even if they are mild. I think that's, a big thing.
There are, and I forget what the names of it were, there are extensive sort of intervention programs around. I mean, where these kids go, I know it's like almost like a school. They go all day long to these sort of intervention programs. I mean, they have to cost a fortune to be part of that. So do you know anything about any of those and their success rate?
I know, there's a lot of different ones, like you mentioned, that are, and I think it depends on the children. They're also unique. Some of them really respond well to that. I know there's a couple of colleges in the East over here that are very geared towards the kids on the spectrum, and had some great success with them flourishing in that environment when they get the right, supports. So there's
one expression I heard over and over again is, when you meet an autistic child, you've met one autistic child.
Yes.
Right? One size does not fit all.
No,
any thoughts on the MMR vaccine?
Definitely, the what was it? The UK, was it UK? Sorry, it's getting late and my brain gets very tired. The Brit, I think it was, sorry. We went in with these studies. We went in with that. I think it was the UK. I'm not exactly sure at this moment. But
There was a British researcher who, and then he became
right,
credited or something.
that's right. And they got sued because they manipulated, the results. When you look at the actual study itself, what they did was they took each, instead of taking like ADHD and autism and each learning disorders, they separated them out to say they weren't significant. But when you added them all together, they increased by something like, I don't know, 238% more. But when you took them separately, and so that's what they did, they said, only 2 out of whatever were autistic, so that wasn't significant. But when you looked at all of them together, there was a huge increase from the MMR. So I know with my son, I went round and round with the pediatrician, and I wanted to separate them out, and he wouldn't. So we ended up, my son did have the MMR, and 2 weeks later, his bowels completely stopped. He had an overgrowth of yeast. I found out eventually after the GI doctor told me there was nothing wrong with my son, even though every week we were in the ER. After we filled him up with food, we had to clean him out because his bowels had stopped moving. So there's definitely, and again, is it just a stressor? What is it? But there is definitely an increase with the MMR.
Do you have any suggestions for supplements, procedures, acupuncture, light therapy for autism? Any sort of general rule of thumb or
No, again,
individual?
yeah, I think it's more individual, although the omega-3s, the probiotics, some of those seem to be pretty, everybody, all the kids usually have some good response to those. So I haven't, and I don't know anything about acupuncture and whatnot as far as with the kids on the spectrum.
Yeah, well, again, acupuncture has an anti-interleukin-6 effect to it, so there should be some effect to it. Any effectiveness for a naltrexone? I'm assuming low dose naltrexone.
Right. Yes. I don't know too much about that one myself, but I know that you mentioned that, I think, Dr. Clearfield, right?
Yeah, we've used it. We actually make it into a cream. It has it shifts the Th1 pro-inflammatory to anti-inflammatory cells, and it reduces interleukin-6 and TNF alpha. And it has effects on these types of behaviors: the self-injury, communication skills, social withdrawal. We've had some success with it, not a whole lot. I was hoping for more. It's used for lots of different things. We make it into 0.1 milligram per kilogram and increase it to a top dose of 1 milligram per kilogram. Side effects: there's some nausea, nightmares, and the rebound insomnia. So we've had some success with it, but again, you're not going to find a cure-all. If you're looking for the cure, so far, I don't know that it's really going to find it. Okay, I mean, you have to just hit it from everything. So the next question is about mycotoxins, mycoplasms, metals, heavy metals, all of that. Yes, we do it all. So, but you have more experience with this than I do. So, have you seen mold infections, yeast, parasites?
Right. Definitely, all of those, and again, it goes back to individual, but definitely, again, them being able to, whether it is, able to fight it or not, they all seem to. The yeast overgrowth is a big thing. I know that's very, very common with a lot of the kids. I've even had some kids that I've seen on nystatin. Personally, I haven't started them on that, and if you try to take them off of that, their behavior just really increases. So definitely a lot of that probably having to go back to like the inflammation in their immune system and that kind of thing. I think.
Dr. Andrew Campbell is sort of one of the gurus of mycotoxins and whatnot. He recommends iatroconazole sporanox. He says has very low side effect profile, is very, very effective. In adults, he does it 100 milligrams twice a day, and he scales it down from there for kids. And I don't have the dose in the top of my head, but he uses that very, very very effectively as far as that innate fungal. Thank you, Dr. Stone. Very informative lecture. Dexter Meforfan, you asked about that. Marianne, I'll get that later.
I
For
need
another
one
speaker.
more information from Dr. Stone.
Mhm.
Please, which colleges are you were recommending for the kids?
I'm sorry, which what? Colleges? I don't know that there's one here that is, gosh, I'm sorry, at this time of night. I can get back to you on that though, if you'd like. Because there's a couple, there's one that's really good here in Hackettstown. And there's one in Connecticut that's really good too. But I
Was the
can't think.
question colleges that are
Yeah.
like studying this? Okay, so again, on the East Coast, Montefiore Hospital has done a lot of research, and out here out west, UC Davis it seems to be a hub, a go-to place. So it's halfway between Reno and San Francisco. Dr. Nario asks, should we refer to psychiatry for low dose Risperdal, or can we prescribe it? And what labs should be requested before use? So,
I actually would do it. I would have you do it yourself because so many, like I said, very few people know about the low dose Risperdal, unfortunately. And lab work, you know, we just do the regular, of course, the hormones and whatnot. Definitely look into those. So not as specific necessarily lab work. You know, we do as many nutritional deficiencies and whatnot as you can do. But yeah, I would do the Risperdal yourself. There's just not enough people who know about it.
I'm looking for the workup here. I have it here somewhere. No, that was here it is. This is what we were doing. You know, all of these, you know, the sort of routine stuff, heavy metals, C-reactive protein, vitamin D, blood sugar, cysteine is a marker for glutathione, and then heavy metal testing, organic acid is a sort of minerals, stool analysis, intestinal permeability, SIBO, MRI, or CAT scan of the head, functional MRI. You know, I mean, not all of these, obviously. And then this is our hormone workup here.
A lot of people have the leaky gut. A lot of kids on the spectrum get the leaky gut. That's another thing that you would want to treat too.
Right. So, how to help with this behavior to help overcome limited thinking?
You know, there's just really trying to tackle as many of the, you know, the toxins and the supplements and everything, because you never know which one is going to be right for that person. They're just, where is it coming from is the problem. It's too unique, I think.
Okay. What do you mean by separating MMR with your son? I have an idea, but I'll let you answer it. So
yeah. Trying to do the, you know, the mumps, the measles, and just taking and having them do each one at least a month apart, separately. And the pediatrician was more concerned about the, I guess it's the measles by itself being more, you know, potent. But I've had other parents do the same thing, and you know, I think it's just healthier for the kids. The stress on their body was a lot less.
this is Dr. I can never pronounce her last. Good Kanawati, I guess. I think thyroid is really important. She had 4-year-olds on the spectrum of Hashimoto's, and a really small dose can go a long way.
Yep,
Okay.
definitely.
So yeah, I've had a few myself, and you know, we make sure that the thyroid function is as normal as we can get it. We like the desiccated thyroids, which, you know, the endocrinologists will scream their heads off if they see that. But
Yeah.
too bad.
Yeah.
We do use the low dose naltrexone for that, and we use plant sterolins, which are actually the fat from plants, and they actually sort of act like Pac-Man in the bloodstream, and they sort of eat up the antibodies. So, so we've had a little bit of experience like that. Dr. A.S. says Mitchell College in New London, Connecticut. Is that a
I have
ring a bell?
not, yeah, I've not heard of that one myself.
If you're on, Dr. A.S., if you unmute yourself and elaborate. If you're here, so I'll ask you to unmute.
Risperidone is very harsh drug. I mean, that's where I got it. Right? So risperidone, it's very harsh drug. It's antipsychotic. They're giving the patient with bipolar and schizophrenia. I think we need to go, a little bit stepwise. So leaky gut syndrome needs to be fixed, yes, and doing oxytocin, possibly some polyphenols. And during the time when the patient is taking vaccines, they really need to be on polyphenols and oxytocin and a little bit boosted up so they can reverse the side effects of the disturbance of the immune system from the vaccine and possibly balancing it. So this is something you can also recommend. If they do a vaccine, then you just give them a pack of supplements along with polyphenol oxytocin to help to make sure that they will not irritate the neuroglia further and aggravate the autism.
Yeah.
But if you go with doing everything there, it's going to be costly and possibly it will be too much. And so we need to learn how to do supplement oxytocin, going with something that's simple. And then if it's not responding, we're going to add more of drugs. So stepwise and going with supplement first, then to the pharmaceutical, I think is the best option.
Definitely. And I also, recommend, of course, waiting as long as, till the children are older, not giving the, first of all the immunizations at the same time, separating them out, at least a month. The regular pediatricians are, so they're just like brainwashed into getting immunizations as, soon and young, because they don't trust, the parents to do what you have to do. They, like I said, I don't care if I'm taking my son, once a month or, every couple months, I will do that. They don't trust that we will actually do that because there's so many, just to get it, basically their thinking is get it in when they come in, because of course there's a lot of low functioning adults and whatnot. They just don't trust us. So you really have to advocate, or find, over here in the East, we don't have a lot of good like homeopath and out of the box thinking docs is harder to find. So you have to really advocate for, the kids.
You have to call the American Osteopathic Society of Integrative Medicine to find the out
So
of
let
the box.
me be more practical here. It's so difficult to redefine or change the routine there, but it's so easy if we say, okay, you want to take the vaccine, but take this pack of supplement at the same time to prevent imbalance in the immune system, because those vaccines, what it does, it really, some of them, it goes more of polarization to Th17 and interleukin 6 over inflammation, and that aggravates the whole condition there. So at least you tell them, okay, get the vaccine as they told you, but just get this pack of polyphenols, oxytocin, and at the same time they take the vaccine. That may help to reverse or prevent the damaging effect of vaccine. But if just tell them separating and trying to change, and sometimes they put you under the umbrella of anti-vax, pull your license out. And that's what's happening to Peter McCall, I think. It's better to go along what they have and try to just patch it as much as you can.
These days, the vaccines are not available by itself, MMR particularly.
Yeah.
I used it in my practice and we were not able to get it. They have stopped making it.
Yeah. That has been, has been a problem.
Statement: hard to find a pediatrician now that will give separate vaccines.
Yeah, and like she said, they don't make them anymore, so it's, basically
Yeah, so the
impossible.
answer is that just tell the pediatrician, add this pack of polyphenols, oxytocin, and during the vaccine, I think that may help too. It's same like COVID vaccine. I mean, sometimes, okay, you want to take the COVID vaccine, take it, but then take this pack of supplements or gummies. Gummies, you can do a lot of things in it. And I think that maybe help to at least reverse the damage or prevent the damage that's coming from any vaccine out there.
Or move to a state where you don't have to take it and just refuse to take it. That's an option also.
Right.
Well, I'm
Yeah,
just trying to come up with practical solutions here. At
No,
least
I
go
understand.
along with the mainstream medicine. Okay, do your thing, but at least let us do things that helps to counteract any side effects from your vaccine, because they're not convinced. I mean, if you talk to Dr. what if his name, I think his name is Peter, but it's anyways, he's the vaccine guy. And his kids are autistic, by the way. Okay. And he's telling, no, my kids he's the one who's creating the vaccines and all that for the kids.
No, I
And
understand, but as long as we got the religion exemption,
right.
and we've got the other exemptions, it's okay for us to take those in effect, and let's just fix that. Let's quit injuring these kids. Just point
That's
blank.
not
That,
true.
you know,
That's
well,
not true.
yeah.
That's
Yeah.
not true. In New York
I
State,
saw-
you can get that.
You
I know.
saw how well that worked during COVID, right? So,
I know.
um,
There are states that are allowing it now, though, just saying.
mhm.
Yeah,
there's
that's
a-
going to be a difficult approach. I think the realistic thing, at least to have, like now, Dr. William, he has a very nice selected pack of things, and that can be done in form of a gummy for kids. And they say, okay, take your vaccine and take this gummy at the same time. Put the beer gummy there, and it's for the kids, and put it in Amazon. And I think that would be
I agree.
right.
But you have to do
That
the
may work.
study before you say that. You have to do the study before you say that. Otherwise, you will be liable for a lot of things.
Yeah.
What do you
Well,
mean?
since
Those
I'm not
gummies
a
are
doctor,
supplements.
Since I'm not a doctor, I really don't have to worry about that.
No,
Actually have a
Patel,
lot
you
of
just tell them this is supplement. You don't need to tell them that this is going to reverse a balance. This is supplement, help to balance your immune system. Okay, you don't need to put a claim
Gotcha.
there.
You
I
can
see
say
what you're
balance the immune system. That is a claim.
No, you can. There is, and if you go to the Amazon supplement, there's some of them say immune boosting. I think they're lowering that. Those word of boosting your immune system, boosting your heart function, boosting, but you're not specific with disease. So I think that terminology is okay, right? Because if you go to Amazon, here we go. There's just type immune
can't-
booster.
You can't
There is.
cure anything. You're not curing anything.
Yeah,
You
we're
can't
not
say
curing
cure.
anything.
You
We're just
can't say
boosting.
treat. You can't say.
Right.
You can say aid.
Aid, yes,
You can
boost,
say
aid.
aid. You can say help. But you
Help.
can't say cure. You can't say treat. So,
Right, and that's what I'm just saying. Just saying, boosting your balancing your immune system. How about that?
it's okay with
Amen.
me.
Immune balancing.
Dr. A.S. says that she also uses homeopathic remedies when taking vaccines. And before I saw the next one, I was going to say Thuja, and that's Dr. Nario already has that. And Dr. Good states she uses polyphenols, vitamin C, and some other supplements along with homeopathics. Connecticut lost a religious exemption, and that's all the questions. So, is there a protocol that you would follow for pre-vaccine? Would you advise parents, especially parents who already have autistic kids? If for whatever reason they have to, they're forced to take it, or the parents want to give it to them, or whatever.
Yeah, again, I just, I think having them on as many supplements, just to keep, basically to help in any way possible, like he said, the immune system, whatnot. But again, separating them out, I just see so much less, it's so much less stressful on their systems if you can separate them out, wait till they're older. And you can do that. I mean, they give, they just automatically give everything, at birth. They give so many different things, and you have to argue and again, just refuse to have those given until they're older. And if your child's not going to be in child care. They're going to be at home. There's no reason to take like the hepatitis at birth. I mean, that's just crazy. Especially,
I know
Go ahead.
there were a lot of them. In a previous life, I used to deliver babies and then take care of them too. And I remember there was, at one point, there were 28 vaccines in the first 15 months of life, a bunch of different combinations, and there'd be new ones coming out every 3 months, and then 3 months later they would be taken off the market because they were causing all sorts of problems. So finally, I said I'm not doing this anymore. I'll give the kids the stuff that we got when we were kids, the stuff that it took 50 years to figure out how to use, not these things that come out in 6 weeks and then they have them recalled because sorry, we have 15,000 kids with seizures now because we gave them this stuff. So,
what about FLCCC? Do they have for babies? Do they have a protocol? I know they do for COVID. I just don't know if they do for babies and for pregnant mothers.
No,
Yeah.
FLCC is completely limited to COVID. I think they are now struggling right now because COVID is out. So they may need to figure out something different, but they don't have any pediatric target or pregnancy target. Just they're very limited in their protocol. I think Dr. William here is doing way better than FLCC.
no, I don't know. Dr. McCullough is doing better. My good pal, Dr. Peter McCullough, is doing way better than me. He got all the publicity, so
All of you,
he gets all the grief too.
you too.
Well,
So
he
Dr.
got smacked too. He got his license
I
out.
said he
and
gets all the
kicked
grief.
out.
Yeah.
Yeah, he got to the frontier. So yeah, McCullough is great. He got the media and attention of the Republican patients, but the problem is that the mainstream medicine did screw him so badly. You don't want to be in that position unless it's politics problem. Politics is not has nothing problem with medical. It's politics, and he's butt heading with them face to face and coming out with the news and Fox News. Definitely, all of that. It's a sword with two edges. So in one side, he got publicity, multimedia. He can be a billionaire out of this, but the other side, it's just the mainstream medicine and wow, how they scrutinize him and pull his licenses and things like that. Just crazy.
Yeah, and he's very reasonable. We have 2 lectures actually on our website. He's been on our Tuesday night. He was back in February, and he was at our conference last year in Las Vegas, and we have that recorded also. And they make him out to be this wild-haired, bomb-throwing maniac, and he's not. He's actually very reasonable, and his reasons are very are very well documented. So
They
Dr.
pulled
Stone,
my YouTube lecture of him. Did they pull yours? Are you putting on YouTube?
It ended up on YouTube accidentally, and they pulled it off. But so we put it on Vimeo, and it's on our website. I put it here, aosrd.org.
So you put it on Vimeo. They pulled it out. I did it for YouTube for him, and they pull it out. They pull out one of mine YouTube too, right? But they reversed the whole thing after 2 weeks, and I'm okay now.
I wasn't going to argue with. I didn't even know it got on Vimeo or on the YouTube. That was our web lady did that, and I had actually told her not to do that, but it ended up there anyway. So I got a stern warning from the YouTube people. So it's on our website, aosrd.org/webinars. Just hit open Apple F, and it was February 21st of 2023, and then March 25th of 2022. There's two different lectures from Dr. McCullough. In fact, all of our lectures, all of our webinars, including this one, are on the aosrd.org webinars, and we usually get a transcript with it. Sometimes we get slides if there's slides, but Dr. Stone was able to pontificate without slides, which is something I can't do, which is pretty good actually. Anybody else have any comments or questions? It's getting late back east. Those of you, if anybody's headed to this is conference weekend. I know Dr. Halas is I think in Houston. I'm in Miami at the AMMG conference. If you're going to be there, make yourself known. I'm doing 2 lectures on Thursday. They gave me 45 minutes to do cortisol and thyroid in 45 minutes. I got it down to 55, just the basics, and they're pretty strict about time. And then in the afternoon, I'm doing a case history. And then on Saturday, I'm doing the weight loss one that we did here. So you've already heard it. And I'm also the moderator on Saturday afternoon, so I'll be able to tell some of my stories, because 45 minutes to do thyroid and cortisol, it doesn't leave me much time for to tell stories. So we got lots of thank yous, lots of pats on the back, Dr. Stone, that this was great. And you did a great job. I know you were a little bit worried. I told you we only bite the speakers on Thursday nights. We don't do that on Tuesdays. And please, thank you for being, part of our group. Bring a friend. I always ask everybody, bring one friend so we can, double our census. And next week we have Dr. David Weiss, who I think is a podiatrist, and he'll be here. He does some integrative and some unique things also. If anybody has anything to that they'd like to present, please let me know. As I said, we have Dr. David Weiss. Our own Ken Crowley will be May 9th, and David Kahn, who does a PEMF, is that it? And John Casey is on the May 23rd. And I finally got Carolyn McMakin, who does the frequency specific microcurrent for May 30th. And we're going to be talking about Ehlers-Danlos syndrome on that night. So if you know anybody who's got that, like our PA here has that, that should be interesting. So so that's what we have coming up. We'll be here again next week, same time, same station. Again, Dr. Halas, I know you're still on. I know you're in Houston this weekend. I think it's Houston, or Dallas, might be Dallas. And we're in Miami. And again, if you're around, let us know. With that, we're going to say goodnight. Thank you, everybody, for being here. Thank you for those of all our regulars. We had a couple of new people tonight, which was great. And please send, let folks know. If you have anybody, send me their email addresses if they're willing, and we'll send them our notices. The last few weeks when we've had people that have vendors, they're offering discounts on their I put it in the weekly flyer. So the glutathione discount, Dr. Watts's group has an extensive line of supplements, and there are discounts for us. Okay, so you get in touch with Jackie Goodling, that her numbers on in the email, and she'll get you a pretty good discount on lots of stuff. So we're trying to expand ourselves a little bit, and hopefully some of our folks will make some money. I hope it's not too difficult, because I don't really know to get into I've had a couple people tell me they can't get into the lecture because we have the sign up form now, which is new, and that gives us an email address for all the participants. If you don't want your name out, just let me know and I'll take it out before, if we're going to send it. So tonight there isn't any, but so like last week we had the biogenics people. So we sent them the emails. I don't know if anybody got in touch with anybody. But if you don't want that, please let me know. We don't want you to go away because of that. So with that, thank you again, Dr. Stone. It was great. You did a fabulous job, and please don't be a stranger, and please come back, and we're gonna lean on you again. Not right away, but count on it sometime this year. Okay.
All right.
All right.
Thanks.
Everybody else, thank you so much. We'll see you again next week, same time, same station. John, are you still there?
Everything's beautiful. Great lecture. Thank you, Dr. Stone.
Okay.
Welcome.
You have
Have a
anything to add, John? How's the medical school coming along?
And the school's doing beautifully. I think you might be surprised how much they have in common with our group.
Okay, well, so
So they're gonna be leaning on you in a bit. So get ready for it.
I'm ready. You know me. I'm a rock. So okay. All right, everybody. Good night, and we'll see you again next week.
And I thank you.